In this video, we will be discussing about the classification of COVID disease into mild, moderate, and severe. As you all know that second wave has hit the country and the condition today is very pathetic. There are no beds in the hospital, no oxygen available for the patients. So we should stop the unnecessary admission of the patients in the hospital. We need to know when the patient has to be admitted and when the patient can take the home care remedies. So let us know how we classify the COVID disease into mild, moderate, and severe. Based upon the clinical criteria, we take SpO2 and respiratory rate, and based upon CT chest criteria, we consider the involvement of the lungs, and lastly, we consider laboratory findings. First, let us see the clinical criteria, in which we see the saturation of oxygen and respiratory rate. The saturation of oxygen is measured by the pulse oximeter. It's a special instrument. It's a handheld instrument which can be fit into the finger. It is available in all the chemist shops. One can buy it very easily over the counter. And the oxygen saturation has to be more than 95 in the normal cases. In the mild disease, if it is less than 94% in the room air, we call it mild disease. And respiratory rate less than 24 cycles per minute. So how to measure the respiratory rate? Keep your hand over the chest. One in movement and one out movement together is called as one cycle of respiration. Such cycles, if increase more than 24 per minute, it comes under mild disease. So if the saturation is 90 to 94% in the room air and the respiratory rate is 24 to 30, it is called as moderate COVID disease and there is pneumonia present in this case. And if the saturation is less than 90% in the room air and respiratory rate is more than 30, it is classified as severe COVID disease. And the pneumonia is present for sure in severe disease. Now let us see the CT chest criteria. Normal or in mild disease, CT chest is normal or there is a less than 25% involvement of the lung fields. In the moderate disease, the 25% to 75% of the lung fields have been damaged. It is called as grade 2 or grade 3. If in the CT chest, if the 75% to 100% involvement is there, we classify it as severe COVID disease. And coming to the laboratory investigations, we consider a couple of investigations. First of all is we do a CBC. In that we see neutrophil lymphocyte ratio. If it is less than 3.2, it is mild, more than 3.2 moderate, or more than 5.5, we call it as severe disease. And CRP is C-reactive protein, non-specific inflammatory marker. If it is less than 40, it is mild. 40 to 125 comes under moderate disease, and more than 125, it is severe disease. And again, ferritin, the ferritin is comes under the transport of iron in our body. If it is less than 500, it is mild. More than 500, it is moderate. More than 800, it is severe disease. And D-dimer is a marker for coagulation. And it is, if it is less than 0.5, it is mild. More than 0.5, it is moderate. More than 1, we call it as severe disease. LDH, if it is less than 300 mild, 300 to 400 moderate, and more than 400, we call it severe disease. Interleukin 6, interleukin 6 is an inflammatory marker. If it is less than 4.8, it is mild. 5 to 50, it is moderate. More than 80, we call it as severe disease. LFT is liver function test. If it is normal, then it will come under mild disease. If it is slightly dearranged, it comes under moderate disease. If it is moderately or severely dearranged, it comes under severe COVID disease. Now let us see about the management of the disease, that is the treatment. How do we treat a COVID disease? In mild, moderate and severe, we give some common medications. They are paracetamol tablet, that is to counter the fever. As the fever is almost all present in all the COVID diseases, we give paracetamol 500 mg 3 times a day in all the diseases, and antitussives, the cough syrup. If the patient has cough, that is SOS, whenever the patient complains of cough, you can give this syrup. Next is tablet vitamin C 500 mg once daily in all the 3 diseases. Tablet zinc 50 mg 2 times a day. Capsule omeprazole 20 mg BD in mild disease, and in moderate also 20 mg BD. And in severe disease, as the patient is severe, if cannot take orally, we give injection pantoprazole 400 mg IV once daily. And fluid in COVID disease, there is a lot of dehydration. So the adequate hydration has to be maintained. In mild disease, the patient is can take orally, so the oral fluids, ORS, or any homemade fluids are advised. And in moderate also, adequate hydration NS can be given, and in severe disease, conservative fluids given through IV line. Next is the hydroxychloroquine. This is not a standard drug, but it is given in some hospitals. So in mild and moderate, it is given. It is not given in severe disease. So in mild and moderate, we give it for the high risk patients which who have the diabetes mellitus, hypertension, cardiovascular diseases, obesity, or age more than 60 years. So it is given 400 mg twice daily on day 1 and followed by 400 mg once daily for the next 4 days. It is avoided in severe cardiac disease. Next is antibiotics. So tablet azithromycin 500 mg once daily given for 5 days in all the 3 diseases. In mild disease, if the patient is allergic or contraindicated to tablet azithromycin, we give tablet amoxicillin clavulanic acid 625 mg twice daily. And in moderate disease, we give injection ceftriaxone 1 gram IV BD. And in severe disease, in addition to tablet azithromycin, we give injection piptas, that is piperacillin tazobactam 4.5 mg, or injection meropenem 500 mg IV 3 times daily. Next, we give anticoagulants in the COVID disease because COVID, it's a inflammatory condition which even involves the coagulation system. In mild disease, as such, there are anticoagulants are not required. In moderate and severe disease, we give injection enoxaparin 40 mg subcutaneous once daily for 5 days. Injection deltaparin 2500 mg international unit subcutaneous for 5 days. In end stage renal disease patients, we give unfractionated heparin 5000 units subcutaneous 2 times a day. And coming to steroid, in mild disease, usually steroids are avoided. In moderate and severe disease, we give injection dexamethasone 6 mg IV once daily for 5 days, or injection methylprednisolone 0.5 mg to 1 mg per kg, that is 60 mg into 5 days. So next, coming to the oxygen support, mild disease patients do not require oxygen support. The moderate and severe patients need oxygen support. That is, in moderate disease, the patient has to maintain the saturation of 92 to 96%. It is given through the various modes. First, it is given to the nasal prongs, face mask, and if the patient is not maintaining the saturation, finally the CPAP is started. And in severe disease, oxygen is given to maintain the target of SpO2 more than 90%. In severe disease, oxygen is given to maintain the target of SpO2 more than 90%. We give through the NRM, that is the non-rebreather mask, 10 to 25 liters per minute, or high flow nasal cannula, that is 10 to 60 liters per minute, or we give through the CPAP, or finally we give to manual ventilation. We follow the ARDS protocol. And next is the proning. You might have heard now in the most of the videos that proning is required in the COVID disease. So in mild disease, you can do proning, but as such, it is not advised. In moderate disease, proning is done. That is 1 hour each position is changed. That is 1 hour you have to be in prone position, and 1 hour left lateral, right lateral, and upright position. Cycle has to be continued. In severe COVID disease, prone ventilation is done for 16 to 18 hours per day. And some other tried are the injection tocilizumab 400 mg. Slow IV is given in 100 ml NS over 1 hour, and it is repeated after 12 hours if needed. Any comorbidities are associated like hypertension, diabetes, cardiovascular disease, they are treated appropriately. Then the trial therapies are in the news. You might have been hearing everybody are running for injection remdesivir. So injection remdesivir is given in moderate disease, that is 200 mg IV once daily on day 1 and 100 mg IV once daily for the next 4 days. Next, plasma therapy is given, lopinavir, ritonavir. They also have been tried. And most important thing is the monitoring in the COVID disease. We have to monitor BP and heart rate once daily in mild disease, 6th hourly in moderate disease, 4th hourly in severe disease, and respiratory rate SpO2 has to be measured 6th hourly in mild disease, 2 hourly in moderate disease, and it has to be continuously monitored in severe disease. And next are the blood investigations when they have to be repeated. That CBC counts, they have to be repeated every 2 days in moderate and daily in severe. COVID profile, once every 4 days in moderate disease, once every 2 days in severe disease, and D dimer has to be done repeated on the fourth day in mild and moderate, and in severe it has to be done on every second day. ECG has to be done on every second day, moderate disease, and daily in the severe disease. ABG has to be done daily in the severe disease. And discharge criteria is that in the mild, moderate, and severe, the patient has to be febrile for the 3 continuous days. That is, the patient should not have fever for 3 days. and there should not be any difficulty in breathing. You can discharge if the patient had first symptom 10 days before. The patient to discharge, patient should not be on oxygen for continuous 3 days. RT-PCR for COVID is not required to discharge the patient. Post-discharge advice for all the patients is that after the discharge, patient has to isolate himself and self-monitoring has to be done for 7 days. This is all about the COVID disease and its management. So if you have any doubts, do comment in the comment section. I will address them in my next video. And please do share and like the video. Thank you.